In the early 19th century, a new group of nutrients was discovered which were called vitamins. Vitamins are organic, micronutrients that are required in small amounts by the body and are essential for maintaining optimum health. Vitamins are classified as essential nutrients, i.e. they either cannot be synthesized by the body at all or the body cannot synthesize them enough to fulfill its requirements, thus the dietary intake of these nutrients is important. Vitamins are classified into two main groups. Fat-soluble vitamins. Vitamins A, D, E, and K are fat-soluble, i.e. they can be easily stored in fat after absorption. Water-soluble vitamins, vitamin B complex and vitamin C are water-soluble, i.e. they are washed out and not easily stored by the body. Although adequate intake of all the vitamins is necessary, regular intake of vitamin B complex and C is vital to prevent deficiency. Vitamins regulate diverse biochemical functions and are necessary for normal growth, survival, and reproduction. As vitamins play a significant role in maintaining several biologic functions in the body, their deficiency results in morbidity and a decrease in the quality of life. Vitamin deficiency results in derangement of normal body functions and increases the risk of developing infectious, allergic, and inflammatory diseases. Today we will discuss the role of vitamins in your body and the need for supplementation in case of inadequate dietary intake. Vitamin A. Vitamin A consists of a group of fat-soluble compounds retinol, retinol palmitate, and beta-carotene. Vitamin A can be obtained through the diet in two forms. Preformed vitamin A from animal sources. Pro-vitamin A from colorful fruits and vegetables. After absorption, both forms are converted to retinol and retinoic acid, which are then utilized by the body to support several biologic processes. Dietary sources of vitamin A: animal sources, liver, eggs, fish, milk including breast milk. Plant sources: carrots, pumpkins, green leafy vegetables, spinach, sweet potatoes, yellow maize, papayas, mangoes. Supports daily replacement of skin cells. It helps conjunctiva produce mucus to prevent infection. Essential for dark vision. Maintains a healthy immune system. It regulates growth, development, and reproduction. The recommended daily allowance of vitamin A is as follows: men 900 mcg and women 700 mcg. Men 900 mcg and women 700 mcg. It is important not to exceed 3000 mcg per day as it will lead to severe toxicity. Vitamin A deficiency disorders is a global health problem. Deficiency of vitamin A causes severe derangement in normal body function and may result in the following: increased susceptibility to infections, keratinization of normal epithelium, dryness of the cornea and conjunctiva called xerophthalmia, night blindness. Vitamin A supplementation has been used to treat measles, xerophthalmia, and malnutrition. Vitamin D. Vitamin D is a prohormone that can be obtained by diet and can also be synthesized in the skin cells after exposure to sunlight. These inactive forms are then converted into an active metabolite vitamin D3 after coordinated reactions in the liver and the kidney. Dietary sources of vitamin D. Fish, fish liver oils, egg yolk, milk, cereals fortified with vitamin D. The following are a few important functions of vitamin D. Calcium and phosphate homeostasis. Bone mineralization. Involved in the activation of T cells and other immune functions. It can suppress autoimmune diseases. Inhibits the growth of tumor cells. The RDA of vitamin D is as follows. Adults less than 70 years 600 IU. Adults greater than 70 years 800 IU. Vitamin D deficiency results in skeletal disorders, rickets in children, and osteomalacia in adults. Vitamin D deficiency has also been linked to autoimmune disorders, cardiovascular diseases, increased susceptibility to infections, cancer, dementia, depression, and anxiety. Vitamin D supplementation. Individuals who are not at risk of developing deficiency can take supplements or stand in early daylight to obtain vitamin D with no severe side effects. Vitamin E. Vitamin E refers to lipid-soluble 4-tocopherols and 4-tocotrienols. Vitamin E is one of the major antioxidants in the body's antioxidant system. Dietary sources of vitamin E. Plant sources. Almond and almond butter, hazelnuts, sunflower oil, palm oil, olive oil, canola oil, popcorn, avocados, pistachios, cashew. Animal sources. Fish, oysters, eggs, milk, chicken. The functions of vitamin E are as follows. They are fat-soluble antioxidants that prevent polyunsaturated fats, lipoproteins, and components of cell membranes from oxidation by free radicals. They scavenge reactive oxygen and nitrogen species and prevent the development of diseases associated with them. Some tocotrienols have anti-cancer effects and can cause apoptosis of tumor cells. RDA of vitamin E is 15 mg and for lactating women 19 mg.
Vitamin E deficiency may present with numbness, vision problems, immune system defects, loss of sense of balance, and muscle weakness.
If vitamin E deficiency is left untreated, it may result in the development of cardiovascular disorders, permanent nerve damage, blindness, and impaired cognition. Although not commonly used, vitamin E supplementation can be effective against asthma, allergies, and diabetes. There is evidence that vitamin E supplements also help treat atherosclerosis, cancer, cataract, and Alzheimer's disease. Vitamin K. Vitamin K is a fat-soluble vitamin, and it was believed that it had only one function, that is helping in the synthesis of coagulation factors, but recent researches have shown that it is a cofactor in the synthesis of several other proteins as well. Sources of vitamin K. Vitamin K can be produced by the normal flora of the gut, but the amount produced is not sufficient for the human body. The dietary sources are as follows: green leafy plants, soybean oil, canola oil, margarine. The functions of vitamin K in the body are as follows. It is important for the synthesis of coagulation. It is involved in the synthesis of a bone-forming protein and an anti-calcification protein. Recent studies also suggest that vitamin K has insulin sensitizing and anti-cancer effects. RDA of vitamin K. Men 120 mcg. Women 90 mcg. Despite being fat-soluble, vitamin K deficiency presents very early after dietary intake becomes inadequate. Vitamin K deficiency bleeding (VKDB) is a disease in the newborns which mostly presents between 3 to 8 weeks after birth with intracranial bleeding. To prevent this, a vitamin K injection is recommended for all newborns. Vitamin K supplements can be used for the following. Neonates to prevent VKBD. As a treatment option to correct osteopenia. There is evidence that it may prevent the development of liver cancer in patients with cirrhosis. Water-soluble vitamins. Vitamin B complex. Vitamin B complex consists of 8 vitamins that are involved in several metabolic reactions, energy production mechanisms, and the transfer of many nutrients. Vitamin B12 levels have a profound effect on overall health, and sufficient levels are required for the maintenance of normal body functions. Sources of B-complex food. Sources of vitamin B complex: B1, legumes, fish, peas, liver, fortified cereals, enriched bread, pasta, rice. B2, eggs, organ meat, green leafy vegetables. B3, fish, beans, chicken, turkey. B5, fortified cereals, liver, kidney, seeds. B6, legumes, organ meat, starchy vegetables. B7, egg yolk, milk, fresh vegetables, cereals, yeast breads. B9, acid, liver, kidneys, green vegetables, fish. B12, fish, eggs, milk, oysters, shellfish. Functions of vitamin B complex. B1, thiamine, maintains appetite. Help release energy from foods. Are involved in muscle contraction and conduction of nerve signals. B2 Riboflavin. Riboflavin is involved in the reactions necessary for the production of proteins. It helps in the growth, function, and reproduction of several cells in the body. B3 Niacin. Niacin is involved in many critical cell functions and energy production. B5 Pantothenic acid helps metabolize the fats, carbohydrates, and proteins obtained from the diet. Is involved in energy production and hormone formation. B6 Pyridoxine, involved in the production of several important chemicals in the body. B7 Biotin, helps in the metabolism of food. B9 Folic acid, promotes the formation of red blood cells. Prevents neural tube defects in the fetus.